Yeah, so I'm Holly, everyone. Nice to meet you. I am a second year medical student at the University of Manchester, and I am a graduate on the undergraduate course after studying biomedical sciences up in Newcastle.
Perfect. So I guess starting off, you've gone through the same process as a lot of the society members watching this. So starting off from the beginning, how do you feel your work experience and your voluntary experience helped within your application to?
I
Yeah, sorry.
think that when you're applying to medicine straight off from sixth form, you've kind of only really got a year to get work experience together. Because at GCSE level, you're a little bit too young to go into clinical settings. And so it's really difficult. And then you apply in that October when you start your second year. And so you've really only got a year to get everything in and done. And that is alongside obviously studying and anything extra that you did. So I actually found that having done a degree and then having that time spread between another 3 years, it actually really helped not only to find work experience because it's unbelievably difficult, but also to not just do work experience for one day or 1 week, but
Yeah.
to carry it out over longer periods and actually see how medicine does change and evolve in different circumstances and settings. And I think that's what makes graduates stand out in that they they've done more and they actually know that medicine is definitely for them because they've seen every aspect that they possibly can at that stage compared to the minimum amount that you can physically get straight from college.
Yeah, I totally agree. I guess having that maturity about you, people obviously looking at a 16-year-old straight out of college compared to you be 21 when you graduate, having that maturity about you gets you into a lot more places. If that be like surgery shadowing or just shadowing doctors in the GP. So I do totally agree with that. What work experience did you specifically undertake?
So I was lucky enough at Newcastle to get onto a surgical mentorship scheme. So I actually got given a surgeon as a mentor for the 3 years I was there, and I undertook shadowing with him. So I was able to see what his day-to-day life was like in clinic and in surgery, which was great. And because I could do it over a long time frame, I got to see various different kinds of patients at different times of the year. So that was really helpful. That was probably the biggest work experience side of things that I did. And then I've done little bits like a week here and a week there, doing NHS versus private, to see the difference because I've got quite an interest in disparities within healthcare and it's something I wanted to take further. And then I've done the volunteering side, so a hospice and my local hospital and having the time to be able to commit long term, because obviously when you are applying straight from college, you then don't know if you do get into medicine, you could end up anywhere over the country. And so you can't necessarily go and carry on what you're doing volunteering wise. But having knowing that I, for 3 years, was definitely going to be in one place, I could
Yeah.
commit long term. And that was really beneficial.
Perfect. Yeah, I totally agree. I guess the main thing for everybody applying, if that be undergraduate or graduate, is the admissions exams. that's everybody's pitfall and everybody's worst fear at the moment. So I guess you only sit the UCAT or did you sit any other admissions?
Yeah, so I only sat the UCAT because I didn't want to basically have the stress of more than one exam, especially during the summertime when you do want to take time away from studying. So I just put all my eggs into UKCAT, as it was UCAT, into those medical schools.
Yeah, and I guess obviously you're here, so you must have done well in it. So how did you find the UCAT as a whole?
I think it's one of the most bizarre exams you'll ever take. Um, I actually, funnily enough, sat it quite a few times out of practice more than anything. So I applied straight from sixth form, got my interview, got my offer, and then A levels, as people will know, don't always go to plan. Um, So then I went to Newcastle and did the biomed side of things. But during that time, every summer I sat the UCAT as like a practice, so that I felt prepared enough for when the time came. I'd done everything I possibly could to get the mark that I needed to then secure a place. But it's a funny one because you can't revise, but you can prepare, and I think it's something that people from a sciencey background, which we all usually are because we've done the like biology and the chemistry and possibly the maths, we're used to revising content and then applying it. But this is just, you're just thrown in at the deep end, so to speak.
Yeah, I guess, as you say, preparation is key, but revising you just can't do. For example, when you get thrown an abstract reasoning question, and if you haven't prepared for it, then you don't know what's going on.
Yeah.
But if you've prepared, you can almost have that systematic approach of going through the different steps that you've learned, basically. So
Definitely.
I think that's the biggest part. So, did you use any specific resources whilst you were revising for the UKCAT?
Yeah, so I actually went on to a Kaplan course for a full weekend. It is quite expensive, so I understand it's not necessarily available to everyone. But I also used the Kaplan book, which I just got off Amazon. And I just made sure that every evening, or I'd maybe do a couple of days a week, like full days, I would just do some practice questions. And I also use the free resources on the UCAT website. I think it's more about doing as many mocks as you can and then finding out where you're really going wrong and focusing on those areas, and also doing it under timed conditions because the timing is horrendous.
Yeah, I think the key point is what you just said, the timing and knowing where you're falling short, and especially when every mark is worth the same. So
Yeah.
it's better sometimes just to move on rather
Yeah,
than.
it took me a while to realise that if I'm struggling on a question, it's better to just flag it and move on because there's going to be an easier question further down. But I think the way that like pre-meds, aspiring medics and medics work is that you feel like you can't move on until you have tried that question and try to get to an answer. But with the UCAT, there's just not time to sit and ponder on a question for 5 minutes because the next 4 questions you could get straight away, and you've just got to think about that.
Yeah, I guess you took the smart approach of, obviously, you probably understand graduate entry medicine now is there's such a bottleneck with the limited amount of courses actually available now. So what universities did you apply to in the beginning, and what made you choose undergrad instead of graduate entry?
So when I first applied, I did it very much randomly. Obviously all undergrad because I'd not done a degree before. And I more just went off, oh, that looks like a nice city and a nice medical school. I think I'd like it there, which is a great way to do it. But I didn't think strategically. So when it came to the second time round for applying, so 2-3 years ago, whatever it was that I was putting my choices in, I went strategically for places that I knew I had the degree classification for, or knew that I would get, where I think I could get where my UCAT score would sit quite well among the other applicants. And then I decided to do 4 undergrads. So I applied to Manchester, Newcastle, Leicester, and Sheffield, purely based on I didn't want to cram 2 years into one and have the extra added pressure of that on top of what already is a stressful degree to do. And I'm fortunate in that I could self-fund it. But I understand a lot of people do go into graduate entry medicine because of A, they've already done a degree and they just want to be out of university and working, and B, the pricing. And you do get more help with graduate entry than you do undergraduate as a graduate.
Yeah, and I guess that's where the bottleneck is at the moment. Again, saying that, the amount of people that I've spoken to on this guest lecture series has opened my eyes from people being able to fund the undergraduate course themselves, which was kind of shocking when I had Kenji on a few months ago, and he said, I think it was like 30 or 40% of his cohort were actually graduates in London, and that
Yeah.
was really, really shocking to me.
Yeah,
But
there's quite a few on mine who I know have done degrees and are then self-funding, and it it's quite surprising to know how many people actually are okay in that situation, but then also how unfortunate it is for those that can't afford to do what I'm doing and have that extra year to maybe lessen the stress of things and have to go down the graduate entry medicine route, which is A, hugely competitive, um, and B, it sounds like a real stressful life.
yeah, I guess with it being such a unique course, then having that pushed into one, yeah,
Yeah.
it is a bit stressful. But I do understand your thought process behind it. I guess so. You got into Manchester. You must have gotten interviews. Was it MMI at the time?
Yeah, it was. Yeah, all of my. I've not actually ever had a panel interview for medicine, so I wouldn't know what to even say to people going through that.
So how did you find the MMI style interviews as a whole?
I actually enjoyed them, funnily enough, because I know they are daunting and they are nerve-wracking. But I think that it's a really nice way to be interviewed, because if you do have a bit of a bad 7 minutes and you think, oh, I really, really messed that answer up, you've then got 6 more attempts or however many more attempts
Yeah.
to showcase the best of your ability and the best of yourself. And I think it's like 7 individual panel interviews, and you get to meet 7 different people who then can form an opinion of you. And I think that personally made me feel a bit more relaxed, knowing that if I did mess up on one station, 6 other people could then still, cheer me on when they're deciding who can get spaces. But then again, I didn't have a panel, so I can't compare to how that was or how that is. But I think the whole interview process can be really enjoyable if you allow it to be.
Yeah, I think the common theme I've had over these past 2 months is that everybody that's had the panel interview enjoyed it,
Hmm.
and actually not so much prepared, but threw their everything into it. And the common trend is that everybody was successful in getting in. So I do totally agree with the MMI style is better because you can have that restart every um every interview basically.
Yeah, definitely.
So I guess how did you prepare for the MMI style? Did you do anything particular?
So I actually made like a big folder, and I sectioned it off into every medical school I got an interview for, because some medical schools at the time did send out questions they were going to ask you or themes that they were going to cover, so I could then prepare in that way. What I didn't do was rehearse answers, but what I did do was write bullet points or things that I wanted to include in certain questions if they came up. So then it would jog my memory in the interview to think, oh, I need to mention that because I think that that fits well with this question. So I kind of did like bullet points to prepare, a bit like a cue card system. And my parents would then ask me a question that was probably a generic question, but it's hard to prepare for every question because you don't know what they're going to throw at you. So I prepared for the generic ones and the ethic ones and, the current issues ones. And then on the back, there would be some little bullet points of things that I wanted to mention if that question came up. And my mum would then, say, you forgot to mention this. And then it was a lot of practicing with people and getting people to sit with me and interview me, not as friends, but as someone that has never met me. But it all worked out in the end. So
Yeah, I guess the weirdest thing about the MMIs is the role play style of questions that you get. So how did you find them? Did you get any sort of role play style interviews?
yeah, so I got a few role plays. I think the main thing that I did was just go into it knowing that I'm never going to meet these people potentially again, like the actors and the actresses. And for the majority, you are playing the character of a doctor or a medical student, and that is what you want to be. So I just put myself into my future self's position. So I wasn't really acting, I was just portraying how I want to be in 5, 6, 10 years. And I think that the fact that it's with an actor or an actress helps as well, because they get into character and it really helps you get into character then. And it's not like doing it with your friend where you end up giggling because it's awkward. It's not awkward at all. I think you've just got to throw yourself into it and forget that you're acting, because you're not really acting. You're still being yourself, just in a random situation that you've just randomly been put in. But you're not acting. You are still being true to yourself.
Yeah, I totally agree. So I guess looking back now, is there anything particular you wish you would have known before you began your time at medical school?
Oh, I think a big one when you go to medical school is you compare yourself a lot to other people, because everyone's come from this thin layer, cream of the crop, did well in high school, did well in college, did well in the previous degree, and then you're put into like a pool and everyone is the same. And I think it's really easy to then compare yourself, that they're doing that and I'm not, or they got 80% and I only got 75%. And at first I did struggle with that, but you're all there for a reason. You all got picked to be there. You're all good enough to be there. And just because someone else might be better at you in immunology doesn't mean that you're worse than them in everything.
Yeah.
Every medical student and every medic beyond medical school has a specialty, and you've got to remember that you're good at something that they're maybe not as good at. And I think just when you first get to medical school, you have to keep saying to yourself, like, they picked me for a reason. I've got a place because I'm good enough. But yeah, I think a lot of people second guess whether it was a mistake them getting in because they don't feel good enough. And it's such a shame that people feel like that. But I think that's the nature of the type of people that we are.
Yeah, I think it's you've been working up to getting that spot for so long, and in the back of your mind how competitive you've been competing against some places 30 other people to get that one spot. The imposter syndrome does kick in once you actually get that space.
Yeah.
So
I think as well, a lot of it is you work up to the top of this mountain and then you get in and the stress like drains from you and releases because you finally got there. And then you start to think, hang on a minute, like, is this too good to be true? And it's not, but it's because that stress melts away and then you're left feeling, oh, is there something that I don't know? Or, but yeah.
No, yeah, I totally agree. So I guess obviously you come from the same degree that I'm currently doing. How do you find the difference between medicine and biomedical science?
Bigger than I thought it would be. There is a bit of overlap with the preclinical side of medicine. So obviously we cover things like immunology and cell cycle and the stages of pregnancy with relation to like estrogen and progesterone and things, which I covered at biomed level. But then when it becomes really evident that it's not a similar degree is when you go into the clinical side of things. So I always say that at biomed, I learned things at the cellular level. So, little cell cycles and reaction chains that happen within certain genes and whatnot. But at medicine, you kind of take a step back and you don't go that deep. You go to like tissue level or organ level, system level, rather than what is happening in that one cell. So in that sense, it's very different because we've gone from looking at things with a microscope to looking at a whole body and a whole person. So it does help in some respects to get the basics that you need, and that a lot of people in medicine who come straight from A levels can struggle to understand at first because it's brand new, whereas we have that knowledge previously. But the clinical side of things, everyone's in the same ball game. Everyone doesn't have a clue what's going on to start with, and we're all like fresh faced and never done it before. So it's got its pros, and then it's got where it just isn't different to coming straight from A levels.
Yeah. So do you feel your knowledge is still heightened when you start, but then everybody sort of like catches up?
Yeah, definitely. I think as well at Manchester in our first semester in year one, we cover like it's the life cycle. So we cover life to death and a bit of everything. And I think that is the most biomed-ish content that we do. And by the end of that semester, everyone is on par, regardless of if you did a degree before or you didn't. It does help going forward with some like genetic-y stuff and but not massively. You're not like the lecturer, you still are learning things that you've not covered and things. So yeah, I'd say that you maybe start off a bit ahead of everyone with some of the knowledge, but it quickly evens out and the playing field becomes the same.
Yeah, perfect. So I guess you come from a biomed degree. There, I don't know at your university, but some degrees can be very competitive in. You all want the same thing at the end of the day. You all want to be hitting those 70% or above, and obviously that guarantees you a first. So, how do you find that's changed when you come to medical school? Do you still feel the competitiveness is there?
There's always a competitive nature within medicine because I think that we're all that type of person, like the type A personality, so to speak. But what you soon come to realize at medical school is it's not about knowing everything in loads of detail enough to get like 100% in the exam, because it's not possible. We cover that much content. Instead, you've got to have knowledge covering everything to a certain level. So what they often remind us is we're not there to learn to be a neuroscientist or a neurosurgeon or a gastroenterologist. We're there to get the same level of like knowledge for everything. So that doesn't mean that you need to be, 70, 80, 90%, because in medical school it's not first 2-1 2-2. It's not graded like that. It's pass or fail. Where it becomes a bit more competitive is, I don't know how it works for other medical schools, but we have like fail and pass, but then we have honours and distinction, and you need so many honours points, or distinction points to then graduate with honours or with distinction. But if you don't get those, you still graduate to become a doctor.
Yeah.
So there is a competitive nature if you want the distinction and if you want the honours, but ultimately it's pass fail. So if you get, if the pass mark, let's say, is 40% and you get 41% and your friend gets 78%, you're still both going to be a doctor. It doesn't make you any less. It's still a pass. But yeah, there's always competition within medical school. You just got to kind of learn to let it ride, or else it can become a bit too much.
Yeah, I guess obviously everybody that is wanted to get into that degree has got there successfully. So do you feel the competition is almost more helpful in like everybody's working together rather than everybody's working against each other because you've all made it at the end of the day?
Yeah, definitely. So there's not really like, if you're struggling, it's not like a case of like people looking down at you and not helping. It's a case of everyone will send you the notes and what they have, and you'd do the same if they were struggling in a different area. It's very much a community, and I think more so with the fact that medicine is a longer degree than others, and you're in more than other degrees, and you do form like a family, because sometimes all you see is medics and you don't get a chance to see other people. So yeah, when it comes to the learning and the educational aspect, it's all very much a I help you, you help me, kind of, we're all in this together. So that's really great, a really, really great vibe to have.
Yeah, I totally agree. So I guess to move on slightly, Are there any particular like myths or misconceptions you had before, obviously coming to medical school, that have changed?
I thought that I would be working 24/7, non-stop, wouldn't have time for a social life, because I think that's how medicine is painted to people.
Yeah.
And I think a lot of the time, if you meet someone new and they say, "What do you do?" "Well, I'm a medical student." "Oh, you mustn't have any time to yourself." And sometimes exam period, I don't have time, but neither does anyone doing any other degree. Exam time is like that. But generally speaking, we get a fair bit of time off, and we still get to go out and socialize when COVID allows, and we still get to do hobbies and things. And I think that's the biggest misconception, that that we just study 24/7 and don't do anything else with our lives.
Yeah, I guess this is the thing I'm trying to obviously portray of myself. Obviously, either going to go into a graduate entry role or an undergraduate, depending on, I guess it's the UCAT. But it's trying to get that misconception of medicine will run your life whilst you're in that degree. Obviously, speaking to you and other med students have shown that you can almost work, or you can almost have extracurriculars outside of it. So how have you found managing your time from a BSc to now being a med student?
It was easy knowing that I knew how to work around a uni timetable, but medicine is very different. So I have to work it personally, where I print my timetable off every week and I plan in everything that I need to do that week, including things like relax, go for a walk, read a book. I have to kind of plan my whole life. And that's probably where it's a bit different to other degrees, because we are in a lot, and our timetable can change variably, especially when we're on placements. So there isn't that I'm in on Monday 1 till 3 and I'm off for the rest of the week. We are in every day. And that's probably the biggest difference. When I was at Biomed, we were in a couple of hours a day here and there, maybe a couple of full days a week. But we had a lot of independent time where you could go out and do things outside of the degree. Whereas medicine, it's a lot of timetable time, but then you also have to do a lot of independent learning, especially with a PBL course. But then there is time to do extra things. So I think in the first couple of weeks, it does take a lot of getting used to knowing how much time you've got to study and how much time you should be studying, and then working out when you can have a day off. So some people take the whole weekend off, some people take just a Saturday or a Sunday off. I know some people that work 9 till 5 every day of the week, but then have the evenings off every day of the week from 5 onwards. So it's kind of juggling how you work, and I think the most important thing is making sure you fit in extracurriculars as a priority. If it's something that you want to do while at medical school, and that's where I plan time in for my dreams of a medic account and when I'm working. But I always put studying first, but I make sure I've got the balance somewhat right in extra things as well.
Yeah, I guess going back to the misconception that you said of medicine is going to be a 24/7 degree, it's going back to the saying of run medicine around your life, not let medicine run your life.
Yeah.
So it's, again, obviously you're going to graduate as a doctor if you put the work in, but again, it's not like any normal degree. You need to pass, and you're going to graduate with the same person that's put all this effort in, if that makes sense.
Yeah. Yeah, you could easily, for medicine, study 24 hours a day, 7 days a week, quite easily, to get to knowing absolutely everything in, fine detail. But then you've got to decide, is that what you want? Or do you want to just have the broad knowledge enough to do well in your exams and get that honours, but also have a bit on the side to relax and to do other things? And I think that's where it's a bit hard at the beginning, because you do think I have to know everything, and we get taught an awful lot, but they're not expecting us to know everything, by memory. We've got to just have enough knowledge of everything to be competent when treating patients. And I think that's what it takes a lot of time for people to realise.
Yeah, so I guess so. Speaking to a few different med students from a couple of different universities, they approach the syllabus in different ways. For example, so I had Faye Bates on, who goes to Anglia Ruskin, and she said it's very much what you're taught you need to know.
Mm-hmm.
Is Manchester the same, or is it more independent research?
I'd say it's a bit of both. So we're a PBL university, so there's quite a lot of emphasis on independent learning. We get lectures every week that you have to know, because that's what is going to, potentially come up in your exams. We have anatomy every week, and you're going to have to know all of that, and things like clinical skills and whatnot. But with the PBL, that's where it gets a bit more of, there's not a solid line of what you need to know and what you don't need to know. So every PBL group comes up with different questions. So that's where it gets a bit trickier to know, do I need to know that because that other group hasn't got that as a question. So we get what's called like intended learning outcomes. So that is kind of what is expected of us, but we could still get asked on extra things, and it's the extra things that would then get you the distinction and the honours points. So it's kind of, if you learn everything that you're taught and that is on the learning outcomes, then you can pass with a really good mark. But then to get the honours and the distinction, you would go into a bit more detail and do a bit of extra reading around things and look at the texts that are put on for us to read, like the research articles and whatnot. So it's kind of however you want to use that, and what you want to actually come out with, whether that's passing with a good mark or passing with distinction.
Yeah, totally agree. So I guess within, if you like to call it a week in a life at Manchester Med School, what does it look like, just so students can gauge like the PBL session to like the clinical sessions, etc.?
So I will do a day in the life of first year Holly, because that was when pre-COVID. So it would look something like, we would have the opening to a PBL on a Monday. So that's where you would get given a patient and all their history and everything written as a story, and you'd come together and think of questions that you want to answer within that week. In the afternoon, I would then maybe have an anatomy class. So that would be a 2-hour session in the dissection room. The next day, on the Tuesday, I would have an afternoon of lectures, so from 1 till 5. And then on the Wednesday, nothing in the morning. And then on the Wednesday, I would have lectures 9 till 12, so like opposites, and nothing in the afternoon, because like other degrees, we got Wednesday afternoons off for sports and society stuff. And then on a Thursday, you might have a clinical skills session. So we call it Phys Pharm, so like physiology and pharmacology practicals. So things like learning how to use spacers when a patient has an inhaler, or giving intradermal injections, or things like that. It varies, and it usually follows whatever the case is related to that week. And then in the afternoon, you might have a communication skills session. So you go and learn to talk to patients and communicate. And we'd have simulated patients come in, and that's who we would interact with. And then on Friday, you might have a couple more lectures, like a wrap-up lecture for the week, just going through the really key details from that week that you definitely need to know, and that you should have kind of taken away from the lectures. And then we'd have the PBL close. So we'd all come back together and we'd answer the questions that we initially set up. And then we'd have the weekend to kind of consolidate anything that we didn't understand and get ready for the next week. And every week would then be a different case. So once you get to the weekend, you've kind of done with that case and you're on to the next one. So that's kind of how it works at Manchester.
Perfect. So it sounds like the lectures and the PBLs are almost they almost relate to each other. So
Yeah. So the
those,
whole week, for example, if we had a case, let's say on, well, in the first year we had a case on spina bifida. So we would have lectures on what is spina bifida, the management and the treatment of spina bifida. We might have a genetics lecture of how spina bifida comes about. And then within PBL, we would come up with questions that would most likely be answered within those lectures. So you can use the lectures as like a way to answer the questions. And then we might have extra questions that we would then go away and research. So it's those extra questions that would differ between different groups. And that's where it becomes a bit fuzzy as to whether you actually need to know that or not, and whether you want to learn it in detail or not.
yeah, totally. So I guess what's your vision going into the future then? Where can you see yourself?
Career wise,
Yeah.
at the moment, I'm thinking pediatric oncology, but it could change. It used to be emergency medicine, but it's now pediatrics, just because I want a bit more of a static patient relationship rather than seeing a patient and then not being able to continue with their care because they get transferred to a different department. But I start clinical years next year, so it may all change.
Yeah, that's one thing I've discovered of speaking to, especially F1 and F2 doctors with their prior knowledge of, oh, I wanted to do A&E when they first came in, and now that they've just completely changed to do like
Yeah,
obs and gynae or some skill like that.
yeah.
So I
I
do
think
totally
clinical
agree.
placements really, really help to show people either what they really want to do or what they really don't want to do. So it's hard to know at this stage, but that's kind of where I'm heading. But we'll see when I get onto pediatrics and oncology whether that is actually for me.
Yeah. So I guess for future aspiring med students watching this video, are there any golden pieces of advice you'd give them going through the application process?
I would say keep your eyes on that golden pathway and that light at the end of the tunnel, because it can seem like a heck of a long journey, especially if you did what I did and applied straight from college and then it didn't work out and then you had to go through the whole application process again, 3 years down the line. It can feel like it's never going to happen, and you're never going to get it like everyone else does. But you have to keep going at it. If that's what you want, you've got to look past what everyone else is up to at their stage in life. And because I know for me it was quite hard to see that when I finished biomed and graduated, all my friends were then getting jobs and I was
Yeah.
going back into education. And even though that is what I want and that's what I've always wanted, it is then you start to see how different people are, like how different the stages are of people's lives. um but I think you've got to keep your eye on that end goal and seeing yourself, graduating as a doctor after all the years of hard work. And when you think about it, the time that you spend applying and doing a pre-med degree or whatever is nothing in comparison to then when you qualify and the life you'll have ahead of you being a doctor. So yeah, try and stay focused, even though it can be hard at times.
Yeah, I mean, yeah, I totally agree with that. If it's something that you really that your heart's set on, there's more use of it doing the degree now than doing something that your heart's set on 10 years down the line.
Yeah,
Because at the end of the day, it's something that you'll know if it's something that you've always wanted to do. And I guess
yeah,
that's a whole that's a whole the whole process of having to sit these really ridiculous admissions tests and going through the interview process and the competitiveness of it. I think it's all part of the parcel of kind of distinguishing you from the people that don't have their hearts on it. So I do
yeah.
totally agree with that.
And I think on the flip side as well, it's probably a weird thing to say on here, but if you get so far and then you think, hang on, this isn't for me, don't be afraid to admit that to yourself and to the people around you, because it doesn't make you any less of a person. You know, you've got to make sure that this is exactly what you want to do, because it's a long road and it doesn't stop after medical school. You know, it is lifelong learning, and it's got to be what you want to do, because ultimately, you know, you've got to be happy.
Yeah, and I think that's not what's talked about enough. And you have to do your foundation years, and then you have to specialize. And
Yeah, it is a long road ahead.
yeah, I think when you're applying, all you're seeing is that first day of medical school. Hopefully, you can get in, but you don't realize, and it's not really talked about the life that you're gonna have to live of learning your profession and your art after you graduate. I
Yeah.
totally agree with that. So I guess finally, for someone just starting out on their first day at Manchester, is there any like take home tips you give somebody that you've learned?
I would say, purely based on the fact that it is a PBL course, that step out your comfort zone, and even if you are the shyest person on the planet, talk to someone, even if it's just one person. You know, everyone is in the same situation. No one knows what they're doing. Everyone, more than likely, 80% of the people will have moved to a new city, having never lived away from home before. Um, and it can seem really daunting when you're put in a room of 12 people you've never met, who you're going to do everything with for the next 12 weeks. I think the biggest thing to do is from day one, just try and communicate with them as best you can. Because if it comes to 3 weeks down the line and you've not had a proper conversation with them outside of PBL, it can make it really difficult for the rest of that semester.
Yeah, perfect. I mean, you've answered all my questions, so thank you for massive thank you for taking the time out of your evening again to come
No
speak to
worries.
me.
Thank you for
It's
inviting me.
thank you. So, is there anywhere our viewers can find you online that you'd like to plug?
Yeah. So I've got an Instagram page which is at Dreams of a Medic. And that's also linked to a Facebook page, but I know not as many people use Facebook. But yeah, feel free to message. I do try and answer them as soon as I can. But there can be a bit of a delay. But yeah, just feel free to, even if it's just for a chit chat or to ask a question. I'm always on my phone, so I'll try and answer.
All right, perfect. Thank you again, Holly.
No worries. Thank you very much.
Thank you. Take care.